Hello juniors, so I welcome you all again in the continued series of lower limb, and today we are going to cover an important topic which is the inversion and eversion of foot. So this is an important topic from university point of view, and in today's topic we will be covering its introduction, joints taking part, axis of movement, range of movement, muscle producing movement, and its clinical relevance. So without wasting any further time, let's move ahead. Up till now you must have seen this image, and I'm sure you must be able to appreciate a little bit that what is inversion and what is eversion of foot. So let's continue with our topic. So introduction. Inversion is the movement that causes sole of the foot to face inwards. So to explain this to a layman, what is inversion? You can say sole of the foot face inwards. But if we talk in anatomical definition, inversion is the medial border of the foot is elevated and sole faces medially. Similarly, eversion is the movement that causes sole of the foot to face outwards, or you can say in eversion there is lateral border of the foot is elevated and sole faces laterally. This is an animation to make you this thing clear. The medial of the sole of the foot is facing medially in inversion, and the sole of the foot is facing laterally in eversion. This kind of movement help in adjustment of the foot on uneven ground. Means that inversion and eversion is necessary for better gripping on uneven grounds. In inversion and eversion, entire foot below the talus bone move together to achieve this movement. We will shortly cover this point. So this is the inversion, that is medial facing of the sole, and eversion is lateral facing of the sole. So joints taking part. In this kind of movements, there are basically two principal joints and one accessory joint that help in achieving this movement. The two principal joints are talocalcanean joint, which is also known as subtalar joint, and talocalcaneonavicular joint. I have already covered these two joints in my video on arches of foot. So this is the talus bone and this is the calcaneum bone. The joint between these two is responsible for accomplishment of the movement. The talocalcaneonavicular, this joint between these three bones, is also responsible for the achievement of the movement. And lastly, an accessory joint, which is the transverse tarsal. So this joint is the transverse tarsal joint, also known as mid tarsal joint. All these three joints are needed for achieving the movement of inversion and eversion. Coming to the axis of movement, the movement takes place around an oblique axis. The axis is somewhat like this. This is an oblique axis around which the movement takes place. Axis runs forward, upward and medially, passing from the back of the calcaneum to the neck of the talus. I'll show you this. The axis runs forward, medially and upwards. I hope you are able to recognize the forward vector, the medial vector and the upward vector, which you have covered in your 11th and 12th class. So their resultant vector would be the vector joining the base of the calcaneum to the neck of the talus. So this will form an oblique axis around which the bones rotate. Obliquity of the axis is partly accounts for adduction, abduction, plantar flexion and dorsiflexion of the foot. The point to remember in movement is inversion is accompanied by plantar flexion and eversion is accompanied by dorsiflexion. This is the point to remember, that while you are making the movement of inversion, the plantar flexion will be associated with it, and while you are making the movement of eversion, dorsiflexion movement will be associated with it. Now I'll show you how inversion and eversion is achieved. So I'll show you like this. This is my left leg, and while inversion, this is the inversion, and inversion is accompanied by plantar flexion, and this one is eversion, which is accompanied by dorsiflexion. Once again, plantar flexion is this and dorsiflexion is this movement. So inversion is achieved with plantar flexion, and eversion is achieved by dorsiflexion. Coming to the range of movement. Range of movement of inversion is much more free, which is approx 30 degree than eversion, and the range of movement for eversion is approx 20 degree. Range of movement increased during plantar flexion of the foot, because in this position the narrow posterior part of the trochlear surface of the talus occupies the tibiofibular socket mortise, which permits extra degree of side to side movement of talus. Now to understand this point, you need to have thorough information regarding anatomy, and what I am marking are these words: plantar flexion, narrow posterior part of the talus, and the tibulofibular socket or mortise. You need to have the knowledge regarding these four words, then you would be able to understand this point, and this point is also relevant with the clinical relevance. So what is plantar flexion? Firstly, plantar flexion is when sole is made to face posteriorly, and dorsiflexion is when sole is made to face anteriorly. Now the narrow posterior part of the trochlear surface of the talus. This is our talus bone. I have zoomed it in. This is our talus bone. This is the upper trochlear surface which articulates with the tibia and fibula, and this is the narrow posterior part. You have to remember this narrow posterior part, which is important for understanding this point. Now he says the tibiofibular socket or mortise. So for your kind information, what is the mortise? Mortise is a classical Japanese wood carving technique in which they used to create a void which was called as mortise, a perfect symmetrical void which was called as a mortise, and a second portion which goes inside the mortise called as tenon. So what is mortise? Mortise is a classical Japanese wood carving technology in which a void is created and another second part which goes into the void, that is made. So here tibiofibular socket is made relevant with the mortise. So this is the posterior view of our tibia and fibula, and this space is that mortise in which the trochlear surface of the talus sits or attaches. So clubbing all the information gathered up till now, this is the broad trochlear surface of the talus bone. This is the mortise formed by tibia and fibula. This is plantar flexion when the sole faces posteriorly. This is the narrow posterior part of the talus bone. Now when the plantar flexion occurs, this narrow posterior part goes into the mortise, creating extra space for the movement. Now you must be able to appreciate this. This is plantar flexion. This is the broad trochlear surface of the talus bone, and this is narrow posterior surface. When plantar flexion occurs, the narrow posterior surface goes into the mortise, giving the extra range of movement for the joint. So for example, the mortise is like this and the trochlear surface of the talus bone fits perfectly like here. Now if mortise remains the same and instead of broad trochlear surface we brings in the narrow posterior surface of the talus bone. So here it gets a narrow an extra range of movement. I hope now you are able to appreciate and understand this point. The range of movement is increased during plantar flexion. So muscle producing movement, for inversion there are two principal muscles which are tibialis anterior, tibialis posterior, and similarly two accessory muscles which are flexor hallucis longus and flexor digitorum longus. For eversion, there are two principal muscles, peroneus longus and peroneus brevis, and similarly one accessory muscle which is peroneus tertius. Now coming to the clinical relevance. The movement of inversion and eversion are necessary for walking on uneven and sloping grounds. This I have covered already, that the movement of inversion and eversion help in gripping the foot on uneven surfaces. Inversion injuries are more common than eversion injuries. Here comes that point which I have made you explained a few slides ago. Inversion is accompanied by plantar flexion. During plantar flexion, the narrow posterior trochlear area of the talus lies loosely in the anterior wide articular area of the lower end of tibia. So inversion injuries are common. So once again summarizing that point. So if this is that mortise formed by tibia fibula joint, and this is the broad trochlear surface of the talus, in plantar flexion the mortise remains the same. What changes is that the narrow posterior surface now sits in this mortise, creating an extra range of movement. And that is why from this extra range of movement, the inversion injuries are more common than eversion injuries. So done with introduction, joints taking part, axis of movement, range of movement, muscle producing movement, and its clinical relevance. If you found this video helpful, do like it, do share it with your friends. Thank you.